Hi again, this is Dr. R going over another epi question. So first thing I'd like you to do is to hit pause and then try answering this question yourself. And not only answer the question, but answer why you think it is correct and why you think these other answer choices are incorrect. Okay, so let's dive into the question. Let's look at the lead-in. Can we answer the question with the lead-in? What is the purpose of using a sample in this study? No, we can't. We're going to have to come up to the question stem. So the first thing that I do is I try to take a look quickly at the answer choices to ensure the results are can be generalized. Well, we'll talk about what generalization means. Exclude, so we'll talk about exclusion, exclude individuals, increase the sample size. So these are all the things that might happen of why we might choose a sample in the study. Remember, sample is going to be the entire population of individuals, and what we are trying to do is we are trying to take a representative sample, And what that means is that the characteristics that are important here are going to be represented in the sample population. So ultimately what we can do is we can say the results of this will be able to be generalized or compared to the population. So if we get results here saying, increase or decrease of something, or the risk of something, or the odds of something happening, then we can say that in the general population, given all of these characteristics, that this is representative of the entire population. And that's the goal. And there's several reasons why we might actually take a sample or do a sample. And so I think that's what this is getting to, is why do we do a sample? So let's get to the question stem. A health researcher is investigating the effectiveness of a new drug, right? So a new drug for treating hypertension. Boy, do we love hypertension. So that's a popular topic, so hypertension. The population of interest is adults over 65, so age 65. So with the history of hypertension. So we are going to look at over 65 with hypertension. Now I don't know if that's the population or is that the sample. My guess it's the population. The researcher obtains a list of 1,000 patients who meet these criteria. So we do have 1,000 patients here from a clinic, and randomly selects 500 of them. So we selected 500. So now which one is the population and which one's the sample? That's right. This is the sample, this is the population, and these all are over 65 and have hypertension. Selects 500 of them to participate in the study. The researcher administers the medication to the participants and measures their blood pressure before and after treatment. So they get their BP, they get the drug, and then they get their BP blood pressure measured. So 2 measurements, they get the drug, and then that's the study. So what is the purpose of using a sample in the study? So let's look at to reduce the effectiveness of the medication. Is that why we're doing a sample? Is that the purpose of doing a sample from the population? That doesn't come from taking a sample, actually. That will come from the results here of the drug and the blood pressure medication. So whatever the results show, we'll be talking about the effectiveness. So that one is not correct. To limit the cost of the study. Does taking a sample of 500 limit the cost of having to sample 1,000? Actually, it does. So this is not an incorrect answer. So I'm going to leave that one there. There are multiple different reasons why we might want to limit the cost of the study. Also, what if this drug, this new medication, what if we had tested it, but we didn't know that it had some serious side effects? So another reason might be safety reasons. Why do we want to expose 1,000 people when we can expose 500? Just because there might be some side effects that have not been previously described or found. So that can be another reason why, is for safety reasons. So do we want to increase the size of the population? Well, that's a little backwards. It doesn't really make sense. Having a sample does not increase the population. So let's get rid of that one. To exclude certain individuals from a study. Well, in this study, we're not trying to exclude anybody. There are times when we want to exclude people, but that might be somebody, so for instance, if we're looking at people that are over 65 and had hypertension, what if they had a previous MI? What if they had a previous heart attack? Would we want to exclude them? Because they might be a different kind of patient compared to somebody that has no MI, right? So these people could potentially be no myocardial infarction, and we want to exclude people with myocardial infarction history because they might impact these factors differently than if they had no heart attack, okay? So, but in this case, that's not what we're talking about. We're not excluding anybody because it doesn't mention any of that. We're not talking about any of the extra or inherent risks that are happening. So B doesn't make sense, so we're not taking a sample of 500 to exclude people. Now let's look at A. To ensure that the results can be generalized to the entire population. Now remember, I come back here and I talked about having a representative sample. So if we had in our sample, so let's say in our population, we had age, we had ethnicity, we had gender or sex, we'll call it in this case. Maybe we had the 1,000 people were from a certain region or location in the United States, because heart disease is higher in certain locations than in others. So there's all these characteristics about our population. If we took a sample, and what if the age was higher? So in our sample, we only chose people that were greater than 90 years old. But, so we had a mean of, let's say, 90 for age. But in our population, the age was 64. Is that the same? Can we compare the results in a population or a sample that has 90 compared to a population that's mean age is 64? What if the ethnicity here in this population was mostly Hispanic, and in here it was mostly white? So is that the same? And so when I say a representative sample, what we are trying to make sure is that this sample looks like this population, given all of these characteristics that might actually impact hypertension. And the reason why we would want to do that is because then, if this looks like this, so instead of it being 90, the mean was 64, and it was Hispanic, and the gender, sex, and location was equivalent, then the results can be generalizable. They can be related, or they can be correlated to what would happen in the population. And that is the power of taking a sample. And then we have to do a bunch of analysis to make sure that our sample represents our population. And when our sample represents our population well, then our results are generalizable. So, to ensure the results can be generalized to the entire population, I would say that this is the most correct answer, that this is actually correct, but it is not the most correct answer given what's being discussed here. So A is going to be the choice that I'm going to choose and is the most correct.